Today, we're going to step outside the hospital, right into our own neighborhoods, to talk about a really crucial figure in healthcare who you might not think about all that often, the community nurse. They're basically the architects of a community's health, and they don't just work to treat sickness, they work to stop it from ever happening in the first place.
So let me ask you a question. When you picture a nurse, what do you see? I bet you're imagining someone in scrubs, probably in a busy ER or a clinic, treating patients one by one. And look, that's a massive part of nursing, for sure, but it's really only half the story. There's this whole other side of healthcare that doesn't just wait around for people to get sick.
Okay, so this is the big shift in thinking. On one hand, you've got the model we're all familiar with, treating sickness. It's reactive, right? It focuses on individual people and curing a disease after it shows up. But on the other hand, you've got this really powerful alternative, building health. This approach is completely proactive. It looks at entire populations, and the goal is to prevent illness before it can even start. And this is the world where the community nurse lives and breathes.
Now, this proactive approach isn't just a nice idea. It's actually a global strategy with a formal name, primary healthcare. You can think of it as the blueprint that guides all of this community health work all over the world.
And this idea, well, it really caught on and sparked a global movement. It all kicked off back in 1978 with this landmark conference in a place called Alma-Ata. Leaders from all over the world got together and declared that primary healthcare was the key to achieving health for all. That moment really set the stage for a totally new way of building healthier nations, and it's a mission that's still going strong today.
So what exactly is primary healthcare, or PHC as it's often called? Well, at its core, it's about making essential care available to absolutely everyone. But the real magic is in the details. Phrases like, through their full participation, and at a cost the community can afford. This completely flips the script. It turns healthcare from something that's just done to people into something that is done with them. It's all about empowerment.
And wow, this approach is so comprehensive. It's built on these 8 connected pillars. I mean, look at this. It covers everything from health education and nutrition all the way to safe water and immunizations. It's this incredibly holistic view that recognizes that, hey, things like clean water and access to basic medicine are just as vital to a community's health as any doctor's visit.
Now, this entire system is built on 5 core principles. Equitable distribution, well, that just means health services are shared fairly, not just piled up in wealthier areas. Community participation is the absolute heart of it. People have to be actively involved in their own health journey. And above all, the focus is always on prevention first.
So, who is on the ground making all of this happen? Who takes this amazing blueprint and actually turns it into reality? Block by block, family by family. This is where we finally meet the community health nurse.
A community nurse wears so many different hats. I mean, yes, they provide direct care, but that is just the tip of the iceberg. They're also health educators, teaching families about nutrition and hygiene. They're planners who are assessing the needs of the entire community. They're counselors, guides, and honestly, fierce advocates who fight to make sure their community gets the resources it needs to be healthy.
And this work isn't just random. It's not about running around putting out fires as they pop up. Community health nursing is a really scientific and systematic process. It's designed to have the biggest possible impact.
It follows this really clear cyclical process. First, the nurse assesses the community. They gather data to figure out what the real health challenges are. Then, they diagnose the biggest problems. From there, they create a plan with goals you can actually measure. Then they implement it, and this part is so important. They evaluate the results. And if the goals aren't met, they don't just throw their hands up, they replan. It's this continuous cycle of improvement.
And this right here, this is probably the single most important idea to wrap your head around. For a community health nurse, the client isn't just one person with one problem. The client is the entire community, with all its unique strengths, weaknesses, resources, and challenges. The whole point is to raise the health of the entire population.
All right, so what does this actually look like day to day? Let's dive into a few really powerful examples of what these nurses are doing out there in the world.
Let's start with something huge, immunizations. Community nurses are on the absolute front lines, making sure kids get free vaccines against at least 12 different diseases. And this isn't just about giving shots. It's a massive public health intervention that has saved millions of lives and prevented countless illnesses year after year.
And when it comes to maternal and child health, their work is just as vital. They're out there identifying and registering pregnant moms, making sure they get the shots and supplements they need, like iron folic acid to prevent anemia. They counsel families on nutrition, and they track a child's growth, which lets them catch any problems super early.
Their work even stretches right into our schools. And school health services, that's not just about a nurse putting a Band-Aid on a scraped knee. No, it's this coordinated system that directly connects a child's physical health to their ability to actually learn and succeed in the classroom. I mean, just look at everything a school nurse does. They do health checkups for vision and hearing, they keep an eye on immunization records to stop outbreaks, and they monitor nutrition. And I think this is so cool. They even go a step further and train teachers and students to become health and wellness ambassadors, creating this amazing culture of health that can last a lifetime.
So, when you start to add all of this up, you really begin to see the incredible power of taking a proactive, community-based approach to our health.
I just think this metaphor is perfect. Community nurses really are the gardeners of public health. They're not just running around fixing broken branches. They're tending to the soil, the water, and the roots to make sure the entire tree, the whole community, can grow strong and really thrive.
And ultimately, the goal here isn't to create more dependence on the healthcare system. It's actually the exact opposite. It is all about putting health back into the hands of the people themselves, empowering entire communities with the tools and the knowledge they need to manage their own well-being.
So I'll just leave you with this to think about. Imagine for a second if our priorities shifted. How different would our neighborhoods, our schools, and our own lives be if we invested just as much in building health from the ground up as we currently do in treating sickness after it's already taken hold?